Pain is when the body feels a physical discomfort caused by illness or injury that we want to alleviate. How can the body do that? In order to drive a reaction to the stimuli, the body undergoes a full process involving multiple body systems. Pain can be categorized into two types of pain, acute and chronic. Acute pain typically comes on suddenly and has a limited duration. It's frequently caused by damage to the tissue such as bone, muscle, skin, or organs. Some examples of acute pain descriptors are aching, soreness, burning, stinging, sharp pain, dull pain, and tenderness. Pain is perceptive and the severity of pain varies from person to person. The first and second person do not feel pain when a typical person would find their situations to be extremely painful. The third person feels pain while performing a simple task. As we can see, some people can tolerate pain better than others. It is known that pain perception varies from person to person and is controlled by the individual's pain threshold. The threshold level can change due to different chemical signals within the body, but once the threshold is met, the nociceptors will fire a signal to the brain and indicate pain. The most influential and best accepted pain theory to date is the gate control theory. It proposes that there is a gate or control system in the dorsal horn of the spinal cord, all through which the information regarding pain must pass before reaching the brain. The substantia gelatinosa in the dorsal horn controls whether the gate is open or closed. An open gate means that the transmission cells, or T cells, can carry signals to the brain where pain is perceived. A closed gate stops the T cells from firing and no pain signal is sent to the brain. Pain motivates the individual to withdraw from damaging situations, to protect the damaged body part while it heals, and to avoid similar experiences in the future. Most acute pain resolves promptly once this painful stimulus is removed and the body has healed, but some pain persists despite the removal of the stimulus. The two main systems involved in producing a response to a pain stimulus are the nervous system and the muscular system. The nervous system collects and processes information from the senses via nerves and the brain, and then transmits the signal to the muscular system, which enables the body to move away from the stimulus through muscle contraction. In the nervous system, the neurons are responsible for transmitting the signal using action potentials from one neuron to the next. The action potential is initiated when the interior voltage of the neuron raises from -70 to -50 millivolts. The axon membrane is a phospholipid bilayer that is not permeable to fully charged ions. The action potential facilitates the transport of ions through the membrane by using ion channels within the membrane. There are voltage-gated potassium channels and voltage-gated sodium channels that allow their respective ions to diffuse back and forth according to their respective electrochemical gradients. At resting potential, the membrane is positive outside and negative inside, in which sodium ions are prevalent outside the cell and potassium ions are prevalent inside. When an action potential is fired, the interior voltage reaches the threshold of -50 millivolts. This depolarizes the axon membrane and causes the voltage-gated sodium channels to open, allowing sodium ions to rush into the cell. Neurons need to transmit their signals from the brain to effector cells quickly and effectively in order to generate a reaction to the stimulus. They do this through chemical signals at the synapses between the axon terminus of a presynaptic neuron to the postsynaptic neuron. When the action potential arrives at the axon terminus, it opens the voltage-gated calcium channels to allow calcium ions to come into the cell. Calcium ions cause the neurotransmitter to be released from the vesicles and diffuse out of the presynaptic neuron and into the synapse. Once the neurotransmitter reaches the postsynaptic neuron, it depolarizes the first position and starts the action potential along the axon of this new neuron. Once the action potential reaches a motor neuron, the muscles become stimulated and muscle contraction occurs as a result. This allows the individual to withdraw from damaging situations involving pain stimuli, to protect the damaged body part while it heals, and to avoid similar experiences in the future.